Cardiovascular system part 2. So today we're going to talk a little bit about the breakdown of how things are made up throughout the whole system, the different parts of it, what those are broken down into, and then we'll talk about the difference between the different vessels, and we'll talk about the electrical system to the heart a little bit today too. So let's get started and do it. This thing will respond to me. There we go. Okay. So, coronary circulation. I talked about this a little bit yesterday when I pulled out the heart here and I asked you guys what these things are called. And you guys knew it, which is good. Coronary arteries. They're also coronary veins. They're not called veins. They're called coronary sinus. But that's the coronary circulation. Coronary circulation is what supplies blood to the heart. Okay, so you should understand if you hear something, anything that says coronary, that has to do with the heart. Coronary means that the blood, the heart's an organ too, right? Yeah, its main function is to supply blood to the body, but it is an organ also, so it needs to supply blood to itself as well. So there's vessels that come off of the aorta immediately after the blood leaves heart, and they go off of the aorta and go directly back to itself. Those are called coronary arteries because they're going away from the heart. And you also have what's called a coronary sinus, which are technically coronary veins, which take the blood back to the heart once it's the oxygen is used and it's deoxygenated. So those coronary sinuses are going back to the vena cava so they can be brought back into the right atrium. Okay, so that's blood supply to the heart itself. Just like any other organ, it needs blood also. So if somebody has a heart attack, this is usually where it happens, in these vessels here, because there's a stoppage of blood to the heart because of blockage somehow. Usually it's because of clotting and atherosclerosis and fat buildup in vessels and stuff that causes it to happen. So here's the vessels here. So if you're looking at the front here, this is the pulmonary artery here, and then the aorta coming over the top. And you can see how off the aorta, you got these coming like this, and there's a bunch of different vessels that separate into each other. So you have a right coronary artery and a left coronary artery. Left coronary has one come off it. It's called the circumflex artery. It's called the circumflex because it goes around the heart. Circum means around. So it goes flexes around the heart. And you have the great cardiac vein down here. And this is the anterior interventricular artery because it comes down and goes between the ventricles right there. So that's all coronary vessels.
So cardiac veins and coronary sinus are the same thing?
Coronary veins and coronary sinus, yeah.
So then what, like cardiac veins, is that separate? It says that on the slide. I'm not sure if that's the same thing.
Yeah, well, it's the same. Yeah, it's the same thing.
Okay.
Cardiac veins or heart veins are referred to as coronary sinus. Yeah. Okay, so this is what the heart looks like. It's kind of like the surgery we were looking at the other day. And this is the pericardium right here that they're pulling away. And you can see the heart. You can see all those kind of squiggly lines all over the heart there. That's all the vessels that are supplying blood to it and taking blood away. It's a big heart, yeah. It might have some cardiomegaly. That might be why they're working on it. Okay, so here's some things that can happen if the heart is not working right. Like I was just saying earlier with the coronary obstruction, coronary vessel obstruction, you can get what's called angina pectoris. And this is general chest pain. It doesn't necessarily mean the person's having a heart attack, but it can mimic heart attack symptoms a little bit sometimes. And it is usually a warning sign that there's a chance that there can be future heart attack issues. So if it's something that is a common thing, a repetitive thing, you have chronic pain like that, that's kind of like short-lived if it goes away, that's something that you need to check out like ASAP, because you don't want to lead to something more significant. So it's usually because the myocardium is deprived of oxygen for some reason. What supplies your muscles with oxygen? What supplies your muscles with oxygen? Arteries or blood, right? Blood, the oxygen is in your blood. So if you're getting angina pectoris on a regular basis, and that means that your myocardium is deprived of oxygen, it means it's not getting full blood supply, which is a sign that there could be some reduction of blood flow in there somehow. And if you get reduction of blood flow in your coronary arteries, or especially a blockage, that's when a heart attack happens. So you don't want to ignore it. Heart attack is the next step. Now sometimes people have angina and they go in and they check it and there's actually nothing wrong with the heart. It's just sometimes indigestion can mimic angina too, and there's some other things that can happen. But it's definitely something that should be checked if it's a repetitive chronic thing. Because you don't want it to lead to this, because a myocardial infarction, which is a heart attack, if any of you taking medical terminology, you should know that. This is medical terms, right? Myo is muscle, right? Cardium is heart. So it's the heart muscle. Infarction means blockage of blood flow from one place to the other. So myocardial infarction means that blood is not going to where it needs to be, and that's when a heart attack happens. So you look at on the right here, this picture is showing a little spot right there that looks like this. This is plaquing in here, and here's the blood flow trying to get to this side. Well, there's nowhere to go because it's blocked. So if that's true, then from this point to this whole part of the heart, there's no blood supply. And if the heart doesn't have blood supply, then what's it not going to be able to do? Anything. It's not going to be able to contract, it's not going to be able to pump. And then that means if your heart can't pump, then what happens? Your body doesn't get blood, and then your body doesn't function either. So, kind of important for that to keep beating, right? So, this right here is why it's important to have a healthy lifestyle and not eat garbage and make sure you stay active. Because this is the most common cause of death in the United States. Right here. More common than all forms of cancer combined. This. And it's all preventable because of lifestyle. So, don't let this happen. So, the heart itself, what does it do? I told you this the other day. It's very active, and it has to constantly beat, right? Every second of every day, from the point that you're developing in your mother's womb to the point you die eventually. So in one day, it pushes about 6 quarts of blood through your body over 1,000 times. So that's a lot of work. And it actually pumps about 6,000 quarts of blood in a single day. So that's a lot of blood. Now, that blood is not like being removed from your body. It's flowing through, it's circulating, right? So that's what's called circulation of your body, of your blood, because it goes through the heart, it goes out to your body, then it comes back to the heart, to the lungs, back to the heart, out to your body. It's being circulated. When you breathe out carbon dioxide, you're breathing the gas out, but you're not really breathing blood out. You are constantly making more red blood cells, though. And your red blood cells only live for about 120 days, so about 4 months, and then they die. Replaced with new ones. So it's a constant regeneration happening in your body all the time. Okay, so conduction system. We talked about this last chapter with the nervous system. Right? We talked about how there's an autonomic nervous system. Right? What is autonomic? Automatic. You want your heart to be controlled by your autonomic nervous system. Otherwise, you're going to have to think every second. Okay, beat. All right, beat. All right, beat. You don't want to have to do that. You won't be able to think about anything else. So your autonomic nervous system takes care of it for yourself, for you, so you don't have to think about it. It does also have like checkpoints in it, and it has a monitoring system to make sure that that beat is happening every time. Your hypothalamus helps with that in your brain. Remember we talked about that in the diencephalon? So that is making sure that that's happening all the time. And it's using a negative feedback loop to make sure that that's happening. But inside the heart itself, you also have an intrinsic conduction system, which uses nodes to communicate through the heart to make it beat. And that's what I told you the other day. I was telling you about automaticity and how it can kind of like store up that conduction for later. I'm going to show you here in a second how this works, but it's got a built-in conduction system inside itself, because if there's any reason why there might be some blockage or stoppage or prevention of nerve impulse to the heart for some reason, you want it to be able to kind of take care of itself for a short period of time. So it has its own built-in conduction system. It goes through depolarization and repolarization and all that, like we talked about in the nervous system, just like everything else does. Okay, so the heart itself is controlled by the autonomic nervous system, and the pumping mechanism is controlled by an intrinsic conduction system that uses nodes to make that happen. So here's the nodes that it uses. First one's called the sinoatrial node, or SA node. The sinoatrial node is found up in the right atrium. Up there is tiny cells up in there, and this is what's referred to as the pacemaker of the heart, because this is what starts the nerve impulse that makes the heart beat. So if somebody has an artificial pacemaker in their chest, it's in there so it can, it's because their conduction system is not working correctly. The SA node is not creating an efficient enough impulse to make the heart work, so that pacemaker is in there to kind of be an artificial source of that. So that's the SA node. That's where how it all starts, the depolarization process. AV node is down at the bottom of the right atrium, where the interventricular septum starts, down over here, and that right there is where, so there's a conduction that happens between the SA node and the AV node down there, and that sends, the SA node sends the impulse to the AV node so that it can be distributed throughout the heart. And it does that through bundle branches, which we're going to look at here in a second. So impulse is delayed briefly to give the atria time to finish contracting, and then there's what's called a trigger effect that basically like accelerates that impulse again. How like pulling the trigger again. So SA node, AV node are the beginning of that conduction. Alright, so here's a picture of it. There's the SA node up there, AV node down here in the bottom of the right atrium. And then the AV node communicates to the rest of the heart through this little bundle of nerves right here, which is called the bundle of His. And that bundle of His separates into these two branches down the interventricular septum, which is the right bundle branch and the left bundle branch. And those eventually become what's called Purkinje fibers. And those supply nerve impulses out to the right and left myocardium on both sides. Okay, so that's the conduction system, which is the nervous system of the heart, which we talked about last chapter. And this is just going through what I just explained in words here. So after an impulse travels through the AV node, it passes to atrioventricular bundle, which is also referred to as the bundle of His. It's not his, it looks like his. Usually when something has a weird name like this, and you don't know what the heck that means, it's usually because that's the person who named it. That's true in this case also. So called the bundle of His because he discovered it and named it. So bundle branches go from there, which I showed you, go down the interventricular septum there, and then the Purkinje fibers come off there and go around the rest of the myocardium. So you should know what all these things are, all these little individual parts are, and the sequence of which they travel through each other. Okay? You good with this? Yes? Yeah. So here it is again, just the same picture going down through what I just explained. Alright, so first impulse travels SA node to AV node, causes the atria to contract. So that impulse right there is causing the atria to contract and causes blood to go from the atria down to the ventricle. Okay, this is what I was talking about the other day, how I said you have that sequence of how blood flows through the body, but it's not going through that whole thing. It's atria, drop blood, down the ventricles at the same time. So when the SA node and the AV node communicate with each other, that's what's happening. Then the impulse travels to the AV node to AV bundle in the bundle branches, which causes a ringing contraction of the ventricles, which I talked to you about the other day, that figure 8 shape of the cardiac muscles, how they wrap around the heart. So as the impulse goes down through the AV bundle and the bundle branches of Purkinje fibers, it's causing that ringing contraction of the ventricles, which causes the squeezing of the ventricles and pushing blood up through the aortic valve and the pulmonary valve, going to the body and the lungs. Okay, good? So SA node, AV node cause atrial contraction. The rest of that sequence causes ventricular contraction with the ringing of the ventricles. Okay, so you can see how the SA node sends an impulse down to the right atrium, and it also goes across the heart down into the left atrium as well. The AV node receives it and sends it down. Okay, so some heart problems that could occur to prevent different sequences of these functions that we just talked about. So, first one, ischemia, which is kind of like an infarction. Ischemia and infarction are very similar terms. Ischemia means lack of blood flow to the heart muscle. So, an infarction can cause that. It can also be a mild disruption of blood flow, which wouldn't necessarily be considered a full infarction. So, what can happen is a fibrillation if you have lack of blood flow to the heart. So, what a fibrillation is a rapid, uncoordinated shuddering of the heart muscles. So it's basically spasming really fast. So, you guys have all seen the TV shows where they pull out the paddles and they say cold blue, clear, and they put those paddles on their chest. Well, those are called defibrillators because they're stopping that sequence. What they do is they don't actually start the heart up. They're resetting the heart. So the heart's in fibrillation, it's spasming, it's kind of stuck in a nerve conduction. And so what those paddles do, so it sends this charge through them, it stops the heart for a second and resets it and allows that conduction system to reset and go back into its normal sequence again. That's what a defibrillator is for. You also have an AED, which stands for automatic external defibrillator, and those are the ones that they have around school and that athletic trainers carry and paramedics carry and stuff that have like electrode pads that you can put on. That's the same kind of thing, but it's not as intense. Handheld defibrillators, you can actually turn them up and change the amount of impulse that are going through them and stuff. All right, so that's fibrillation. Cardiac cycle. Atria contracts simultaneously, atria relax, and then ventricles contract. So that's what I was just referring to earlier, the atria contracting and then the ventricles contracting. When the contraction of the ventricles is occurring, that's called systole. So if you see the word systole, this is the active phase of the heart, systole. Okay? Diastole is when the heart is at rest. Now, when I say heart, I'm referring to the ventricles because the ventricles are what's going to be pumping the most amount of blood. And that's what the most impulse is occurring in the heart. So systole is when the ventricles are active, and diastole is when the ventricles are at rest. You guys, if you've ever learned about blood pressure, you've heard of these words before too. Systolic and diastolic pressure and blood pressure. Systolic is measuring the pressure on the vessels when the heart is active, and diastolic is measuring the pressure on the vessels when the heart is at rest. So that's where those names come from too. So you should understand what systole means in diastole. So what happens in the cardiac cycle? Average heartbeat is about 75 beats per minute, 73 to 75 beats per minute. That's an average adult. That's what I refer to as textbook average. Not everybody is going to be 73 beats per minute or 75 beats per minute. If you're somewhere between 60 and 100 beats per minute, you're within normal range. It all depends on the person. Some endurance athletes are even under 60. So you have to understand history of people and their activity level and stuff, and their cadence and stuff on them too. So, but length of a cardiac cycle is about 0.8 seconds. So, about 1 to 1.5 beats per second. It's a lot more efficient. The heart's a lot more efficient, a lot stronger. So when it pumps, it can pump a lot more blood at a time. Well, their heart still beats faster when they are active. But, your heart, it's just like any other muscle. If you go work out your biceps a bunch, your biceps are going to get bigger and they're going to be more efficient and stronger when you want to use them. Your heart's the same way. If you're an endurance athlete, you're constantly strengthening your heart so that it becomes more efficient. You don't have to work as hard during the day.
It's like the heart needs less movement to do the same amount of work.
Yeah, right. Okay, so I talked about this a little bit yesterday, or when we went over the valves and stuff. The lub-dub sound when you listen to the heart. Any of you have ever listened to the heart with a stethoscope? You hear 2 beats at a time, lub-dub, and that's considered 1 beat of the pulse. So the lub-dub is 1 beat. So now what that is the valves closing. So when you hear lub, it's the AV valves closing, which is the tricuspid and bicuspid valve. So those close, you hear the lub, and then the dub is the semilunar valves closing, which is the aortic and pulmonary valves. So those close, and you hear the dub. Okay, so that's what you're hearing. So those valves top and closed. These AV valves close when the blood goes, or when the atrium contracts and the blood goes from the atrium to the ventricle. The other ones close when the ventricles contract and the blood goes from the ventricles the body or the lungs. I talked about this a little bit the other day too, how sometimes when you listen to the heart you can hear kind of abnormal sounds. Normally the flow of the blood is nice and smooth and even, and all you're hearing is that love dove sound, and that's about it. But occasionally a valve is not working correctly, or there's a defect somewhere in the heart of some sort, and you hear something a little bit different than normal. And that's what's called a murmur. A murmur is defined as an abnormal sound. What the murmur is and what's causing it, that's what you have to do more investigation to figure that out. But it's just an unusual sound. So I was telling you the other day where if the valves are not closing all the way, you hear like a whoosh sound, like a shh, 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 and along with the love dove. You may hear a third sound, like the love dove, and then another sound along with that. That could be a defect in the valve as well. So basically a murmur is just telling you there's something more you have to investigate and figure out why you're getting that abnormal sound. So first step is usually an EKG, then an echocardiogram, and then further analysis after that if necessary. But, usually they can figure it out just by doing those two things. So cardiac output. So the last couple of things here to talk about how why is your heart doing all this stuff? Well, the main purpose is to supply blood to your body, right? So that's what cardiac output is. It's the amount of blood that is sent out to your body from your heart in a minute. So that's it's something that you need to understand. As far as this slide goes, you need to know the difference between cardiac output and stroke volume. Cardiac output is the amount of blood that your heart sends out in a whole minute. Stroke volume is the amount of blood that your heart sends out in one beat. So, like, a stroke is like one stroke, like if you're throwing a boat, stroke once. If you're playing golf, one stroke is one swing. So, that's how you can try and remember this. A stroke is one occurrence. So, stroke volume is how much blood is coming out in one beat. Cardiac output is how much you're going to give out in a whole minute. You want to figure out your cardiac output, and you know how much blood is given off with each beat, then you can just take the heart rate and multiply that by the stroke volume, and that gives you what your cardiac output is. And they were showing at the beginning, you pump about 6,000 liters a day throughout that whole process, on average. Bigger people need more blood, smaller people need less. So that's an average. Okay, regulation of your stroke volume. This is a negative feedback loop, just like everything else, most other things in your body. You have cardiac muscle cells that are stretched, and stronger contraction. The more they're stretched, the stronger the contraction will be. So it's kind of like a recoil. It's kind of like if you have a rubber band, the further you pull it back, the stronger that snap is going to be back when it comes back. The same kind of thing is going on with the elasticity of your vessels too, and your heart muscle itself. The venous return is the amount of blood coming back from the body after it's being used. If you have somebody that has cardiac failure, congestive heart failure, their elasticity of their heart has been lost a lot. It's basically like a sagging sack, the heart. And its contraction is very weak. So it actually retains a lot of the blood in it. It doesn't push as much blood out as necessary, and also the venous return is very minimal, so they'll get a lot of edema around their whole body, mostly in the ankles and feet and stuff. So if somebody starts getting a lot of like cankles. You guys all heard of cankles, right? Somebody gets a lot of edema and like swelling in their ankles, and you can squeeze their ankle and still see your fingerprints after you take your hand away. Then that's a bad sign. It's a sign that the blood is not returning back to the heart as well as it should. It's usually a sign of possible congestive heart failure. Alright, so here's your regulation, how your body regulates the function of your heart and what's going on. Parasympathetic nervous system. What happens when is the parasympathetic nervous system active? When are you using your parasympathetic? Are you using it right now? Yes. Yeah, you're all using it right now. Sure. Okay, that's parasympathetic nervous system. When your parasympathetic nervous system is active, then your heart rate is lower, cardiac output is lower. But if you have something happen, like you got a crisis or some kind of stress or something like that, then your blood pressure goes up, blood volume goes up, and the sympathetic nervous system becomes active. And that's going to cause more pumps, more blood going out, and in kind of dilation and inflation of your vessels so that more blood can flow easily. If your blood volume decreases, then you get less venous return, then you're going to have less stroke volume, and that's kind of like congestive heart failure problem I was talking about earlier, or if you have a hemorrhage where blood is being released and going somewhere where it's not supposed to be, your blood pressure will go down, your heart rate will go down a lot, and so if somebody gets in a major accident and their heart rate is really faint and their blood pressure is really low, that could be a sign that they have some internal bleeding somewhere. So those are all things that kind of have to be monitored and you have to be aware of, understand why that's happening. So that's just a chart there to kind of explain different situations. Okay, so stroke volume tends to be relatively constant unless it drops suddenly. So that can be your stroke volume declines, your cardiac output is maintained by a faster heartbeat. So your stroke volume is you're not getting as much out with each beat, so your heart's going to beat faster. If you have less return, then that's going to be the opposite. So the heart doesn't depend on the nervous system because it has that automaticity and it has that individual conduction system, but it is controlled by the autonomic nervous system too. So chemicals, hormones, and ions can affect it too. If you have a lot of toxins in your body, your heart will beat faster. Hormones will affect your heart rate too. Adrenaline increases your heart rate. Serotonin slows it down. So it's different hormones that will affect it as well. Alright. So, and this is what I was talking about earlier. These last couple things here. So this picture up on the top right, this is pretty much what your heart looks like when you have congestive heart failure. It's basically like, you guys have all seen like, an older man who like walks up a few stairs and like is already out of breath and having trouble kind of functioning. You've probably all experienced that. That's basically what the heart feels like when it has congestive heart failure. It's constantly trying to do work, but it's not able to pump as much as it needs to. It's not able to do its full function. So the fluid kind of pools in there a little bit, and then the venous return is very low too. So the efficiency is very lax, so there's circulation reduced, and then you got edema and fluid buildup and stuff throughout the whole body. Usually occurs because of atherosclerosis, and which is clogging the vessels. And it can happen in the coronary vessels too, which is a early indication of possible heart attack. Okay, so congestive heart failure is definitely not something that you want to experience, and it's preventable just by healthy lifestyle choices. eating properly, being active, getting enough sleep, reducing your stress, all that good stuff. You guys good with this? Yeah? And this is going into more detail what I was just explaining. Pulmonary congestion and peripheral congestion. So this is the edema and the fluid accumulation I was talking about earlier. So it's going into a little more detail of how that happens. If it's in the pulmonary system, then the left side is unable to eject returning blood. The left side, the blood is coming from the lungs, it's getting in there, and the left side is not able to get as much blood out to the body. And the blood vessels in the lungs become swollen and fluid accumulates in there, and you get pulmonary edema, which can basically suffocate the person because they don't have enough. They have too much fluid in their lungs, it's not going to function efficiently. Peripheral edema is the opposite, or not the opposite, but it's where the right side of the heart is failing, and that's that accumulation in the ankles and stuff that I was talking about earlier. So pulmonary congestion is because of fluid accumulation in the lungs. Peripheral is in the body, feet and ankles. That's it, yeah. Okay. So, moral of the story is take care of your body, because if you don't, then it's not going to take care of you. Any questions?